Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We have now administered more than 397,500 doses of vaccine in our province. I want to thank Albertans for their patience as we book appointments. We are dealing with a supply chain that sometimes changes quickly without warning, and we are working to get doses out as quickly as possible. This means that sometimes there will be minor changes when unexpected events occur. For example, a shipment of Moderna vaccine that was set to arrive in Alberta earlier this week was grounded outside the province due to mechanical issues on an airplane. As a result, this has delayed the shipments to 43 pharmacies, which will get their vaccines a few days later than expected. We understand that these sorts of delays are frustrating, and we are delivering the vaccine as quickly as possible once it arrives in the province. We do still have appointments available, though, and tomorrow AHS will open bookings for the next 3 birth years in Phase 2A. Albertans born in 1952, 1953, 1954 or earlier, and First Nations, Métis, and Inuit people born in 1967, 1968, 1969 or earlier will be able to book online or through 811. Bookings for this new cohort will begin at 8 o'clock tomorrow when the tool comes back online. Pharmacies continue to book appointments for everyone born in 1956 or earlier. Please be patient, as all pharmacies and Alberta Health Services teams are doing the best they can to book as many Albertans who are eligible as quickly as possible. Turning to today's update. Over the last 24 hours, we have identified 479 new cases of COVID-19 and completed about 10,800 tests. This puts our positivity rate at about 4.7%. We have identified 50 new cases of the variant of concern. About 11% of our active cases are currently variants of concern. Looking to schools, there are currently active alerts or outbreaks in 283 schools, or about 12% of all the schools in the province. Currently, these schools have a combined total of 1,199 cases since January 11th. There are 262 people in hospital for COVID-19 treatment, including 44 admitted to the ICU. Sadly, I must announce that 4 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family, friends, and loved ones who are mourning these individuals. Today is St. Patrick's Day, a day for many that is typically spent in the company of friends at pubs and parties. Instead of crowding into a local bar or someone's house with friends or co-workers today, I ask you to respect and follow the restrictions in place and celebrate in a safe, distanced way to help prevent spread of the virus. We know that COVID loves a party, especially ones inside where people mix and mingle in close proximity to each other. This is why indoor gatherings are currently not permitted with anyone outside your immediate household or 2 designated close contacts for people who live alone. Whether it's for St. Patrick's Day today, a loved one's birthday on the weekend, or catching up with friends on any day, it is important that we gather as safely as possible. Outdoor gatherings are allowed, especially as the weather warms up and the days are getting longer. Currently, we can gather with up to 10 people outdoors, but attendees should remain distanced at all times and follow public health measures. We have seen cases recently where variant COVID-19 has been transmitted outdoors when people are not distanced or masked, so please continue to apply precautions even outside. If you go to a restaurant or pub, please respect the rules in place for these establishments. Only go with members of your household and have no more than 6 people at a table. This is not the year for gathering in restaurants and indoors with friends on St. Patrick's Day. In fact, it is against the rules. If you live alone, only go with your 2 designated close contacts. I would also like to be clear that these rules apply to outdoor patios at restaurants and bars as well. Please remember that the staff in these businesses did not make the rules, and they are enforcing them to keep all patrons and workers safe. They deserve to be treated with kindness and respect. A year into the pandemic, I know we are all tired of COVID-19 and the many restrictions that are still necessary to prevent uncontrolled spread of the virus. I know some wonder how gathering indoors can make a difference. I would like to provide a recent example of just how quickly spread can happen in small, seemingly innocent gatherings where measures are not followed and Albertans are caught unaware. In this example, person A has a relative over for an indoor visit. There was no masking or distancing and the visit lasted for hours. During that visit, person A becomes infected with a variant of concern but is not aware. A few days later, that person attends an indoor event at another household of 4 people. We'll call them persons B, C, D, and E. There is again no masking and no distancing. All 4 people get infected with the variant, but also are not aware. 2 days later, person B visits a friend in another household and variant spreads to that person's roommate. Person C goes to work and transmits the virus to 2 colleagues who in turn spread it to 2 children and at least 4 more adults. From 1 case to 14 cases in just 11 days, driven largely by indoor gatherings. This is how easily transmission can continue onward to more friends, family, colleagues, and those we don't even know. All transmissions in this example happened before people had symptoms and they did not know they were infected. In fact, in this real-life example, all transmission events took place before it was even known that person A had COVID-19. This example is not meant to shame or blame. It is meant to show just how quickly cases can spread and why it is so important that we follow both the detail and the spirit of the measures in place for just a while longer. We are so close to getting through this. With a provincial vaccination program that will see every adult Albertan who wants to be vaccinated receive their first dose by the end of June and second doses by late summer, we are nearing a safe return to a more normal way of life. With widespread immunization by fall, the risk of gathering with our loved ones for a family dinner or holiday celebration will drop dramatically. That means that Zoom birthdays and FaceTime Christmases can be replaced by gathering in person. Before we know it, virtual gatherings and celebrations will just be a memory of how we adapted and found ways to connect with one another during the pandemic in order to keep our loved ones and communities safe. Until then, let's all keep making safe choices and protecting our communities by following the rules in place. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Kevin Nimick, CTV.
Hi, Dr. Henshaw. There are now over 1,000 variant cases in Alberta. Where are we tracing the source to? Is it travel or community spread?
Our current variant cases, the vast majority, particularly the B117 variant in particular, is being spread in our communities. As in the example I shared today and many other examples that we're seeing, the B117 variant is spreading in many different contexts and many different settings, and we're seeing higher attack rates than we typically do in settings where people are exposed. Thankfully, so far, our P1 variant cases and the B1351, those 2 variants are the ones originally identified in Brazil and South Africa. The cases that we've seen so far of those variants have been very small in number and linked to travel. But the variant originally identified in the UK, that variant has become established in the community. While we are continuing to work hard to slow its spread, it is spreading in all zones in our province.
Is there a follow-up, Kev?
Yeah, I'd like to hear your advice for spring break travel, both within the province and interprovincial travel.
I strongly recommend against interprovincial travel for spring break. It's clear that in many other provinces, spread of COVID-19 and variant cases in particular are escalating, and traveling at this time outside of the province risks further escalating that kind of spread. particularly as we in Alberta are seeing spread of variant cases. Internal to the province, if people are considering traveling, I would recommend that that travel be just with their household cohort or an individual with their 2 close contacts, that they not be staying in another individual's home. Again, that continues to be against the rules and is a activity that we see causing a very high risk of spread. And individuals who are wanting to do something for spring break, I would recommend staying relatively close to home, doing something with, again, households or perhaps outdoor social gatherings where that distancing can be maintained, because we are at a very important time right now where we are seeing variant cases spread. We haven't yet reached our vaccination coverage that we need to prevent severe outcomes. And so for the next couple of months, including spring break, we need to just hold on and protect our communities with our choices.
Operator, could you put through the next caller, please?
Jesse Weiser, Global TV. Hi, Dr. Hinshaw. Thanks for taking my question. Yesterday you said those in 2A would be able to get a vaccine within the next 3 weeks. Some pharmacies are booking that age group into May and beyond. Should Albertans who booked through pharmacies wait until their birth year is called for AHS appointments and instead book through public health to get an earlier appointment?
I would recommend that Albertans in that age group who want to get a vaccine sooner, that when their birth cohort is eligible through AHS, they can rebook their appointment and get a vaccine sooner. It's critical if they do that they cancel the original appointment that they booked with the pharmacy. It's also important that Albertans continue to check Alberta Blue Cross as additional pharmacies may be added when additional supply is available. So any Albertans who do have that appointment booked farther out, if they wish to get a vaccine sooner, will have the opportunity to do so.
Is there a follow-up, Jesse?
It's the 3rd day in a row with no deaths in long-term care. Do you think this is a sign that vaccinations are working?
It's very encouraging to see the downward trend, and I think that it absolutely shows us the powerful impact that vaccination has had on long-term care residents, both in minimizing the chances of infection as well as preventing deaths. It is also important to note that the individuals who live in long-term care are not the only ones at risk. And we do sadly continue to see deaths occurring in individuals who live in the community, who are at high risk, which is exactly why we need to hold on just a little bit longer to make sure we have the opportunity to provide immunization to all those who are of older age or who have chronic conditions before we make any changes that might put people at risk of being exposed.
Operator, could you put through the next caller, please?
Lauren Kugel, Canadian Press.
Oh, hi. Thanks for taking my question. Just wondering, given where the variants are at and where the test positivity has been and the R value has been, how things are looking for moving to stage 3. I guess the soonest that could happen would be Monday.
Stage 3 decisions on the path forward are made looking at a variety of factors. It's really important to look at the positivity rates, as you say, the R value and the new cases. Given our trends in variant cases and the increase in positivity over the past few days, of course, that does need to be considered. But the final decisions are made by Cabinet with looking at multiple different factors.
Is there a follow-up, Lauren?
I don't think you said in your remarks, I might have missed it, what the hospitalizations and ICU numbers are at?
So hospitalizations today are at 262, and ICU, I believe, is 44. Just one moment, I will confirm. 262 in hospital and 44 in the ICU, yes.
Operator, could you put through the next caller, please?
Jennifer Lee, CBC.
Hi there, Dr. Hinshaw. I'm wondering if you could give us a sense of what percentage of those hospitalized with COVID-19 have variant cases, or a number, and if you have that. And then just to follow up on moving to stage 3, I understand that Cabinet makes the final decision, but what would be your personal comfort level with moving to the next stage of reopening, given where we are at with all those factors that you mentioned?
I don't have the number of hospitalized cases who have a variant infection, but we can provide that offline. We can find that out and get back to you. With respect to moving forward with further easing on step 3, one of the things that is really critical to consider again is that we are starting to see in other places around the world, such as several countries in Europe where the B117 variant has become dominant, even in places that did have a very high second wave, that they are experiencing a very significant third wave, which includes a spike in deaths. We're seeing other provinces in Canada that are seeing rapid acceleration of cases, and we need to make sure that we are watching closely other jurisdictions and considering all of those factors in any potential easings and moving forward, given that, again, we are in this very critical time where the variant is rising and we don't yet have enough vaccine on board to protect those who are most vulnerable.
Is there a follow-up, Jen?
Yeah, thanks. I'm wondering, do we have a sense of how much variant spread is going on in the community beyond what we're picking up, given sort of that growing positivity rate that we're seeing?
What we've seen when we have looked at our serology results over time is a fairly consistent trend that when we look at the overall antibody positivity of the population in monthly serology, and we look at the number of tests that we have that are PCR positive, we have in the past seen that we are picking up again, about 1 in 4 cases. So certainly there has always been spread in the community that we don't identify with PCR tests, but we are doing quite well compared to some other jurisdictions that would be picking up, for example, about 1 in 10 cases. So I think that it's fair to say that there is more spread in the community than we see with our PCR diagnosed cases, and that is exactly why we need Albertans to be following the rules in place in every activity they do, because we never know when we're going to be in the presence of someone who may be infectious, whether it's with our dominant strain or variant strain. And so we need to make sure, just like we need to wear a bike helmet every time we ride a bike, we need to follow the public health measures every time we are out with the activities of our regular day, because that is what will prevent COVID-19 from spreading widely in our community.
All right, there is one question left in the queue, so operator, please put through our final caller.
Julia Wong, Global News. Hi, Dr. Hinshaw. There are still AstraZeneca vaccines available 1 week after bookings opened up for this age group. Is this a surprise, and what do you think about the uptake?
We did see significant uptake as we were announcing the openings of additional years. We didn't want to have people disappointed, and so when we did have a small number of doses left, we shifted to taking appointments only through HealthLink and not online. And so it could be that people are not aware that there are a small number of doses left of AstraZeneca, and that it's that same age group that was previously eligible who can book those appointments. So if there is someone in that age group, and again, that would be identified on Alberta Health Services website, which age group is eligible, it's important for those individuals to know that there are still a small number of doses left and that appointments can be made through 811.
Is there a follow-up, Julia?
Yes, I also wanted to follow up about sector-specific transmission data. You had said on January 20th that we could expect that in the coming weeks, and it's been almost 2 months. I know that there was a bit of an update a few weeks ago, but just wondering, where exactly do things stand in where cases are being transmitted, and when can we expect full data to be released?
We have been working with our analytics team on that, as well as many other pieces of work that need to be done. And unfortunately, as we respond to all of the different factors that we need to with our analytics team, sometimes particular pieces of work can take longer as other more urgent priorities come forward. What is important to remember about the detailed information that we are working on providing is that It relies not only on our analytics team, but also on the frontline case investigators and contact tracers, and the way that data is entered into those frontline systems. And so there has been, as we've been looking at that data, work with those frontline teams to make sure that information is being captured in a consistent way so that we can offer the best possible snapshot overview of what kinds of patterns we're seeing within that transmission data. What we're seeing is that when people are close to others outside their household, when they're not masked or distanced, and when one person is infectious, it spreads very quickly. And especially with variant cases, we're seeing again that happens more easily than with the previously dominant or currently dominant strain. So I think ultimately, whether that kind of interaction happens in a social gathering outside, as I mentioned, we have seen transmission in those, whether it's somebody who either isn't aware or perhaps is tired of the restrictions and there's an indoor social gathering, we're seeing transmission happen in those events. We are seeing transmission happen, again, in any location, whether it's coworkers who are in close proximity, not being masked or distanced, whether it's individuals in a restaurant or fitness facility, anywhere where someone is infectious and people are not distanced and masked, there's opportunity for spread. And that's really, again, what we're seeing consistently in our cases is that when we let our guard down, COVID spreads. We continue to work on trying to get that overall snapshot, but at the end of the day, what people need to know is that whatever setting they're in, if the COVID-19 precautions are not followed, COVID can spread, and it can spread quickly.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe evening.